Hello, I'm Dr. Apurva, consultant obstetrician and gynecologist at Kiran Multispeciality Hospital, Karmangarh. So, we'll be discussing about fibroids in pregnancy. So, most of the patients get panicked, they become over anxious thinking about fibroid when it is diagnosed during their first trimester early scan. So, fibroid during pregnancy is a very natural phenomena, and 10 to 20% are only symptomatic. Rest of the fibroids during pregnancy, they usually do not cause any symptoms. So, fibroid is nothing but an overgrown uterine musculature, and it is a hormone dependent kind of a growth. So, as it is a hormone dependent kind of a growth, sometimes fibroid can grow in pregnancy. Unless and until the fibroid is not disturbing pregnancy, it is better left alone. Because of the presence of fibroid, there is no need to go for a termination. So, what are the problems which can be anticipated during pregnancy? If it is a first trimester, the location of the fibroid, if the fibroid is closer to the gestational sac, it might cause miscarriage, it might cause bleeding. So these are the first trimester complications, the most common one being a miscarriage. The very rare but a possible complication of fibroid during second trimester is red degeneration. The blood flow to the fibroid is decreased and it usually shrinks, causing tissue necrosis, which causes severe pain in pregnancy. So red degeneration is a possible complication which has to be managed conservatively. So giving an adequate amount of IV fluids, adequate rest with normal painkillers should be helping. And fibroids during third trimester sometimes again can cause red degeneration, or they might cause malpresentations, breach or a transverse line, depending on the location of the fibroid. If the fibroid is occupying the cervical area, which is a cervical fibroid, in such a case it might cause malpresentation like a breach where the head is above and the legs are towards the cervix, or a transverse like kind of a presentation. Or if the patient sets into labor, there can be dysfunctional labor, like the contractions are not adequate and the contractions are not sequential, which has to be there during a normal delivery. The fibroid may also interfere with the bleeding pattern postpartum. Sometimes it can cause atonic postpartum hemorrhage because the uterine musculature is disturbed over there because of the presence of this abnormal growth. So the muscle does not contract following the delivery of the baby. In such a case, she might land up with postpartum hemorrhage. In such a case, we give usually the oxytocics, which usually respond. So if the fibroid is found before pregnancy, it's better to get it removed and then plan pregnancy. If the fibroid is diagnosed incidentally during pregnancy, better wait and watch and do not terminate the pregnancy because of the presence of a fibroid. And if the fibroid is persisting, if the fibroid is diagnosed during a cesarean section, it is always better to go for a cesarean myomectomy, taking adequate precautions. Thank you.